Hello, everybody, and welcome to the AHA podcast. Another week of insightful industry commentary. Welcome, everybody, and hello, Jennifer, Alyssa, and Jacqueline.
Hello.
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 So, Alyssa, looks like we got a lot of rollouts coming up. Tell me about it. We got a packed summer, right?
We do, yeah. So during the summer months, usually in July and August timeframe, the carriers have their FMO partner summits for their distribution channels, and we attend those. Those are great because we get to not only meet with the carrier leadership and get some insights, but we also get insights on uh, first looks. Get to know what markets they're planning on being hot in, maybe some information about commissions and just different things like that. So we'll be attending those. And then we also have NABIP Medicare symposiums. For example, in Florida in July, it's July 27th, I believe, in Orlando. We'll be at a table at the Florida NABIP Medicare Symposium. I know there's one in Oregon, right, Jen, that's coming up here pretty
Yeah,
soon this
it's
week.
tomorrow. It's actually tomorrow and Friday
Okay.
in Oregon. We're going to be participating in that one with a lot of our staff and our agents. So that's
Yeah,
exciting too.
huge
Yeah.
a huge number of advocate agents are in leadership roles in NABIP.
Yeah, definitely. So we attend those. So you can look for us there at those NABIP events. And then every time we go to one of those carrier partner summits, we spread that information to our agents. Whatever we can share, we'll share right after as soon as we know. In fact, I think I'm going to a couple and I try to like live stream from there or like do live videos from there and put out whatever information we're allowed to share.
Yeah, yeah. And then
I love it when you
Jacqueline.
do that.
Yeah,
Yeah,
it's
I do
fun.
I
It's
do
fun.
too. I do too. It's really exciting. Makes you feel like you're on the journey with her. Jacqueline, we also have a NABIP event coming up, don't we?
Yes, so we have a NAIFA Medicare Collective Working Group session that is now available for registration on Tuesday, July 1st, noon to 1 p.m. Eastern Time. And that is a great call to register for and attend. And I know you'll be speaking there, Darwin. So it'll be great for our agents and others to also tune in to hear about all the great work that we're doing.
Yeah, yeah, we'll have some fun facts for the industry. It's amazing to me that there's so many people in our industry, and yet, like other industries, they have associations and they benchmark, industry data and best practices. And we really just haven't evolved that far yet. So, how many agents are there? How many agents should there be? How many agents per beneficiary is appropriate? If 5 million beneficiaries are coming in every year, how many new agents should we have? How long does it take to make a great agent? How many agents are retiring? How many health plans are there? There's all kinds of basic business data. Well, that'll be good, and I'm looking forward to that. And then, Alyssa, I think there's also some survey activity, right? We're going to be talking to nationwide brokers and beneficiaries to get firsthand insight into their views.
Yeah, I think that's exactly what we want to hear is from the beneficiary and how working with a good local quality broker actually enhance their whole Medicare experience. I mean, we want to hear the good, the bad, and everything, and that's why we're doing this survey. Obviously, it's not just to like farm the good news, but I think overwhelmingly that's probably what we're going to come out with is to show policymakers, because I know again, there's been so much activity, hearings, different things where I think the misinformation out there is rampant on they're only hearing the bad stories. I feel like that's just where the spotlight is. And we want to hear true, real stories and real feedback from Medicare beneficiaries about did they work with an agent? What was their experience like? Would they do it again? Would they recommend their agent? Like, we want to get all those data points so that way we can present the real picture to Washington and let them
Yeah.
know this
The
is what we're
ground truth,
doing.
right? The
That's
person
right.
closest to the problem understands it best. We're in the homes of hundreds of thousands of beneficiaries, and we consult and engage with even more who aren't customers, but we do advise, and they're in a good place where they are. So we leave them be. Um, Also, it's interesting. I've seen in my travels now. I've been doing a lot of work in DC, and I have a extensive military career before that. I've seen people kind of the ends justify the means. So I've seen people that want to protect their grandparents or someone's grandparents, which is a worthy thing. And they hear one bad story about a bad actor, and they use that to justify sometimes their own bad behavior. And it's kind of crazy. So people are, they feel like someone's profiteering off grandma, and they're on a war path, and take no prisoners kind of attitude. But in reality, every industry has some bad actors, but they're throwing the baby out with the bathwater, in my opinion, because there's so many great stories we see every day. Jacqueline, was there anything this week or last week from the client care team that you want to highlight for us?
Sure. Yeah, recently we had a case where a member called in and she let us know that she heavily relied on the transportation services in her plan, and she realized that she just had a few more left remaining of the year, according to the plan that she was on. And she actually reached out to the health plan to see if she could make an exception to get a couple more transportation trips included because she had an orthopedic surgery coming up that year and knew that she would need those trips to the appointment and to the procedure and back. And so she was anxious because she knew she had a set amount of times she needed that transportation service, but a limited number left. So when she called our team, she was nervous, saying, this was not improved. My plan told me I only had these many trips available. And one of our team members actually was able to help her find a transportation service at a senior um, facility center next door to where she lived, actually. She was in proximity to it. And they agreed to provide her the remaining of the trips for the rest of the year for her medical appointment. So she was very thrilled, and we were able to help alleviate that, anxiety for her.
Yeah, and I applaud you. I saw the note from the broker, who was so grateful and just said, "Hey, I could have never done this for my client." And it really highlights the quality FMO role and the resources that we connect. A lot of people think that Medicare Advantage is all about just Medicare Advantage, but there are so many other resources in the community qualifying for Medicare or Medicaid, in the first place, being advised while you're still employed by your employer, what to do when you get into that window to avoid penalties, veterans benefits, in this case, community organization benefits that are,
Yeah.
not related to the plan, but round out maybe something in the plan. And you can even do a better needs analysis if you know that there's some community resources, because then maybe you don't need one plan versus another plan because you could get the transportation elsewhere. I remember one of our brokers would tell the person to pay cash for one drug out of pocket because they would save so much more money, but that one was the sticking point on the formulary. So there's a lot of creativity out there. How about you, Alyssa? Any success stories on the agent care team you care to share?
Yeah. And, going into that a little bit more, like, I feel like I think I heard something one time where if you have a negative experience with something, you're 5 times more likely to tell people about it than you are like a positive experience. And that always stuck with me. So I feel like the negative stories get put out there like with a broad brush. They just want to paint kind of the whole industry that way, which is really disheartening. Like to hear stories like that where agents actually did great things, they might not get told as much. And I feel like I would love to like have a weekly story that we share or something like that because it does happen like that often. I had one this week. One of our regional managers reached out to me and had an agent with an issue with a client who was getting surgery for breast cancer. And the surgery was scheduled for early November. But meanwhile, the member just got told that her hospital is going out of network with the plan that she's on, which, as you can imagine, caused a huge amount of stress to her. She's preparing to go through breast cancer surgery. Um, then finding out your hospital might not be in network and it might not be covered. But we discussed the continuity of care program through Medicare, where if you're under active treatment or have a surgery scheduled like that, you could get that covered at in network cost. And the regional manager was so happy to hear that this might be, the thing that would exactly help the agent help the beneficiary and put her mind at ease. And, I sent her all the information about it so that she could go ahead and help the member work through that with her plan. And that was, again, just another thing that a broker is helping the member with that we're helping our team with. And so it's just all good news.
Yeah, a lot of times I think CMS makes good rules but they're not promulgated, they're not generally known and available. And I think CMS just thinks that the carrier automatically knows or that the provider, but they don't. And so that's a key part of the integration and the value that we add. So how does that work? Get you and Jacqueline, give me a little more on that program. I thought it was 90 days, but it's more
Mhm.
than 90 days, huh?
No, I think initially it is 90 days. There's actually a great PowerPoint about it that we have, but
Where is that?
well, it's a Medicare PowerPoint, but I can definitely share it in the link. But
But it's
uh,
not in Advocate University, it's at CMS?
this one is not, but it's soon to be an Advocate Health University on our Advocate for Agents portal. Now that you say that, it will go out there for sure. But basically, if somebody is undergoing an active treatment plan, even if they have a scheduled non-elective surgery, so non-elective, it can't be something, not life-threatening. It has to be something that you definitely need. Could be a pregnancy, a terminal illness. Those would qualify if you're undergoing a course of inpatient care from a provider or facility. Those are the things that would allow that continuity of care program where you can get charged the in-network pricing.
Okay. So, shifting gears a little bit, Jennifer, what's up with Humana? Last I checked in, they had canceled the call center contracts, I think, with almost everybody. But then they were going to announce if they were going to turn that back on or not, I think in April. So, is there any update there? Is there any new news on the Humana front as far as call centers go?
There is no new news on that. I do see a lot of folks out on social media, and we get a lot of calls in the office from agents because right now they have like a moratorium on allowing agents to recontract that have ever been contracted with Humana before. That's across all FMOs. And they haven't at this point opened it up. So basically, if you're a brand new agent and you've never been contracted before, you can come on board anytime. Um, but at this point, if you've ever been contracted in the past and had your contract terminated for any reason, like not necessarily a bad reason, right? But maybe you just, they do lack of production terminations and things like that. They're not allowing those agents to recontract for now, and hopefully they'll open that back up. But at this point, we everybody kind of knows that, and it's been a big question, um, and it's been difficult. Kind of circling back to what I just heard you guys talk about, I just wanted to comment. They're to the point where, we hear a lot of the bad news stories coming out of Congress. I think it's so wonderful. I think agents should know that some of these organizations like NABIB and NAFA and in the work that the FMO collective are doing is getting some of those good news stories out and being really proactive to let some of the folks up in Washington know the work that quality brokers do. So I get questions all the time from agents like, what are you hearing? What's the latest and greatest? Because they're worried and they feel like there's like a little bit of that the sky's falling feeling right now. That agents are worried about like, our commission's going to be totally taken away? Are we going to have Medicare Advantage anymore? And so I think it's so great the work that you're doing, Darwin, and other people. It would be worth, I think, explaining again what NAFA and that FMO collective is. I think we did it on another podcast, but if someone's listening right now, just knowing what you guys are doing, it might be worth talking about that a little bit if you could
Sure.
share.
Well, thanks. I'd love to. And Jacqueline is instrumental in that work as well. And I would also say it's not just NAFA and a lot of people already know about NABIP, but NAFA is a breath of fresh air. The senior people and the more accomplished FMOs have come together under that umbrella, and we have a unified voice for the industry, so we can talk to Congress and CMS about what happens. When you turn off commissions on a PDP, there's an impact, and that may or may not drive people to an MAPD plan, but that's definitely something they feel, and having that unified voice, which our industry has never had before until just a few months ago when I joined. Um, Also, they're conducting a working group, and they're starting to build, agent groups because of the experience that the agents have. So we can work on issues and bring that to bear. And I would say it's not just NAFA. I mean, I certainly would encourage everybody to join NAFA and support that. And we meet every week and we all talk together about what's facing the industry and kind of a long term approach. But Better Medicare Alliance (BMA) is doing a great job, and they've got Stephanie Carlton. They've got a senior CMS person speaking, and BMA does a great job. They've got a lot of things that they're publishing. Also, there's been some changes in another big, or the official congressional oversight body for Medicare is MedPAC. And so Jacqueline and I have a meeting with the MedPAC leadership team, and we're going to be talking about quality brokers and the quality metrics and the five I always talk about: accretion, rapid disenrollment. Those two things are huge.
Mhm.
And then annual retention, complaints to plan, and complaints to Medicare. And if we could just get all the carriers to report on those five metrics. Now I know carriers want more things done and they want us to collect more data at the point of enrollment, and all those are absolutely worthy endeavors. But we have to have a single yardstick that we can use across the industry, so you can compare one agent to another, or one carrier to another under the right circumstances. And that's very important. So thank you for bringing that up, Jennifer.
Yeah. The other thing I was thinking too that you got me thinking about was, the carriers are looking at a lot of those metrics. Like you said, some of them are a little bit different. But it's really got me thinking, about when we bring new agents on, not just, Advocate as an FMO, but all the FMOs, or if, you're an agency that is a downline and you're recruiting agents. We have a lot of that activity going on. It's really important to bring good people into this industry that are wanting to be in it for the right reasons. I know that everyone has to make a living, but I try to just, when I say, how do we bring good people in there? It's like, if they want to do the right thing and they care about seniors or beneficiaries, that they care about their grandparents, they relate and they want to do the right thing, the money follows. I when I'm listening to someone, I still love talking to agents that are getting into this industry. If I hear them say like the word money more than I hear them say I can't wait to help somebody, or asking questions about the industry, or wanting to know how they can get out in front of more beneficiaries, that's a red flag to me. There's certain people we just probably shouldn't be in this industry, and I don't think that as a whole, that the whole FMO people as a whole should be only promoting how much money you can make in this industry. I don't think that's what healthcare and this is about. So that's what I try to think about. I think that's how we're going to come and move this industry to quality, and that takes a long time. That's not something that can be done overnight, but if we just each work hard and we all kind of have that mentality, I think we can have a lot of success. So,
Yeah, well, I'm glad you said that. And, we've all met that salesperson with commission breath, as opposed to someone who's really goal aligned with you. And, brokers and FMOs alike, the quality component really comes down to, first of all, why you're in the business, right? And if it's a servant's heart, that's the starting point. Because healthcare, a lot of people didn't go to med school or become a nurse to get rich. They're healers. They want to help people. They can make a good living in many vocations, and there's plenty of work to be done. That's for sure. But I don't think people understand that the community licensed broker, they spend years building those skills and building that knowledge, and they have the state license that says they are the professional that cares for the client. They're the ones that offer the professional guidance to help a person pick a plan, and furthermore to help them pick a doctor based on the needs analysis. And that's important work. That's their job. It's really interesting too, Jennifer, because the unique thing and what I love about Medicare Advantage is that it's prevention beats cure. So when you enter the value stream early and you can educate and advise, if you've got the right heart and the right skills, which most of our brokers do, um, then then you really are helping the system ease the burden later. Because if you catch it as a symptom, or if you catch it at stage one, or if you put them in a program that manages the disease, you ultimately stop like type 2 diabetes unmanaged and unchecked. it can lead to amputations and dialysis and multiple emergency room visits and laser retinopathy. And so it's horribly, painful for the person and their family, but it's also very expensive. And so having programs that are proven and getting involved when it's pre-diabetes, right?
Yeah.
Getting involved uh, maybe if you don't have the money and you're in a program that has a fitness membership, or it has a coach, it has nutrition counseling, all those non-clinical things that yield results. That's what I love about Medicare Advantage, but you have to have the right kind of person and they have to have the right experience level. And so some of these bad actors that are very transactional, it's a problem because they have 90 days of experience. They're probably, reading from a script. They don't have local knowledge of the network. And that's why I created those 5 lagging indicators of quality that I just mentioned in terms of the accretion rate, rapid disenrollment rate, among others, because that's how you can measure. Because there's plenty of good people that work in a call center. I know people that are senior leaders in call centers and they're great people and they've got great agents and they're going about the business exactly the way that they should. But it's only when you look at the results that matter, right? Did you have a high success rate of the people that you enrolled becoming members, right? Did you have a high success rate of people staying more than 90 days? They already lose the money. So there's no benefit to putting someone on a plan that isn't right if they're going to leave in 90 days because they take the money back anyhow. So it's not even in your own best interest to do it. But where do those rapid disenrollments come from? Primarily from some flaw in the needs analysis or some oversight. They didn't know that they needed something, oxygen. They tried to save $10 on a copay only to find out that some other thing reveals itself later. There's a couple legitimate reasons. In fact, there's legitimate reasons for every single one of those things. There's a legitimate reason to rapidly disenroll. There's a legitimate reason to not accrete. So that's the complexity of our business is you can't make a short judgment. You can't act too quickly. But if they're firing low on all cylinders on all 5 metrics, it's certainly worth the carrier taking a deeper look and maybe remedying that with some additional training or other.
Yeah, they're terminating a lot of agents that are having
Mhm.
a lot of bad metrics. So I think a lot of the bad actors are being removed, and they're really. I'm glad to see the carriers providing a lot of metrics, and I think there's a lot of proactive work that can be done there too. But I'm proud of the metrics that we are seeing that we get graded on by the major carriers. I know Alyssa. I always have to say she won that quality award from a large carrier. That was a beautiful thing. It was like
I'll hold
we
on to
sent
that
her
forever.
your Emmy.
Yeah,
Um,
exactly. That was my Oscar moment.
Well, your
yes.
numbers are always good though, Alyssa. No, but you're
Yeah,
right,
I
Jennifer. Go
yeah.
ahead.
No, I was gonna say I am definitely proud of that, and I know of at least one carrier who's starting to tie CTM response with commissions, like literally withholding an agent commission or withholding the renewals if an agent doesn't respond in the time frame for the CTM. So I think we'll see more of that coming down
Yeah.
the line.
Well, and also we got to be careful the other way. And the reason that I came up with the 5 metric, excuse me, although they're not perfect, is we don't want to hang someone's career on a CTM. The way that they define a complaint to Medicare, I think, is a little bit too general. I think the consensus is that even if it's a complaint and it's not founded, you're still guilty. So you're kind of guilty until proven innocent. So really, I don't like just one, and quite frankly, not even two. Right. So I mean, accretion rate is a good one, but I think you got to take it in the totality. And I think that it's important to you don't want to harm someone's career who's been doing good for 20 years and then some fluke happens and then they're automatically out of the game. We don't want the opposite of that, no matter how well intended. And so that's why I think that the FMO council, other smart experienced people trying to make best practices and guidelines, it's really the carrier's responsibility. We don't need CMS or the legislative branch making new laws or new rules. We should, pare down the rules that we have and then follow them. And then I think the carriers can share best practices. And that's why Jacqueline and I, with input from you, Alyssa, and Jennifer, we're writing the guidebook, and it's got the suggestions and challenges for CMS. It's got ideas for carriers about how to manage it. It's got best practices and, checklists for what FMO should be doing. Cause, a lot of people get paid to do an enrollment or to be an FMO, but are they really doing that work, right? Are they just collecting a check? Are they financially engineering an organization to get a bigger override in a direct contract? Or are they out there innovating an agent care team and a client care team and, collaborating with the carrier to figure out how to better serve a beneficiary in the beginning of the process so that things go smoother later. So those
Yeah,
those are important things.
they're important. One other thing I will say, just going back to the complaints to Medicare or complaints to the carrier. I know that agents that sell a lot of plans, it's just going to happen, right? Like the law of large numbers, and the
Mhm.
agent's probably going to get one of those. And what I'd like to say to an agent who does get one is not to panic. This is a chance for the agent to provide a response. Most of those complaints that we see come back unfounded, but it's important to address them and answer them right in the time frame that they want the answer, and just lean on your FMO, lean on us if you need some assistance with just like the process or how to respond. Don't provide don't just answer the question. Don't provide like a whole bunch more information that's not necessary. Just answer the questions that they want you to answer, and lean on us, right? Alyssa, I don't know if you want to add on to that, but I just figured it'd be worth mentioning because it's funny. I just met with an agency today, and one of their long-term agents got one and just was really
Mhm.
concerned about it. And they get really scared. Like you said, Darwin, this is their livelihood. Um, and I just want agents out there to know if you ever get one that it's not the
Yeah.
end of the world.
And it's fairly innocuous, right? You could have a beneficiary that calls into Medicare to ask a network question,
Mhm.
and then it poof, you now you got some explaining to do, right? Not that they shouldn't have called you in the first place, but clients do what clients do, and if they call CMS for a legitimate question, that's a question, not a complaint. That's why I say they over broadly define what it is, and then the majority of them are unfounded. Yet they sort of put you with the lens that there's a problem because it's kind of like where there's smoke, there's fire. So I think that we can work together. But CMS is open for business. They're very reasonable in my opinion. They're listening, and now they're not just listening. It used to be one way; they'd be like, "Oh, I can't say anything, but you can talk." Now it's an actual collaboration. I can say, "Hey, what are you guys thinking about this? Like, are you trying to just save money, or are you trying to improve wellness?" And they're like, "Oh," and so now we're having a collaboration, which is very um, gratifying, right? Okay, last round. Any comments? I got two closing comments, but I'll let you all anything you've got, feel free.
Not for me. I think, Jen, you pretty much hit the nail on the head, right? Law of large numbers when it comes to allegations and CTMs. And, we do a lot of training on Advocate Health University on our platform where we tell agents kind of the best practices to avoid, hopefully, getting an allegation. Number one key, I think, is following up with the member. If they stay in touch with their member, if they stay engaged with them, they can usually head off problems before they become an allegation or a CTM. Making sure your member knows how to contact you, because if they have a question, again, you want them to call you, and you can usually clear it up. And the worst thing an agent can do is to not respond. That's what we always stress, right? Like the worst thing you can do is not respond to an allegation. Then you don't get your
Stay in
story
court.
out there. That's right. And that's not a good look for an agent to not respond to one of those. So we do follow up with agents, make sure that they're getting those responses in timely. Call recordings, as cumbersome as it can be to record phone calls, in some cases it can, save the agent and head off a lot of headache. So
Yeah,
that's what we
listen, in
recommend.
the old
Hmm.
days, we used to call it the tie down, and you would do two things. You would take the old Manila folder and you'd put a rubber band around it, and you'd put your card in there, and you'd say, Miss Jones, we made a lot of important decisions today, and if anybody should ever call you and make you
Hmm.
rethink that over the hours we spent together, go ahead and give me a call, and we'll sort it out together. And then they would call them back in 3 days, and they would just say, hey, not nothing magical about 3 days, 2 days, 3 days. But they would call them back and just say, hey, you made a good decision, because those are big decisions and people have buyer's remorse and they forget. And a lot of the complaints, I think you could validate, Alyssa, are they didn't know they were on the plan or they didn't know that they enrolled, right? Isn't that one of the top,
That's the
you
top
know?
one, basically, is the member says they didn't consent to enroll.
Yeah.
Um,
And I would
so
imagine that's true sometimes, but the way that you make sure that they know that they did consent and the way that you help them just not have, quote unquote buyer's remorse is you do what we call the tie down. Now, you don't
Mhm.
probably have a manila folder and a rubber band anymore, but you still can tell them that they made a lot of important decisions and that you put a lot of time together. Good needs analysis takes hours of research before you
Mhm.
get there, plus a lot of work and education while you're there, plus a lot of follow up. And that follow up phone call, I think that just letting them know that they made a good choice, seeing if anything's eating at them, I think that really lowers the anxiety level, and I guarantee it'll impact the metrics.
Definitely.
Jacqueline, Jen, anything else before I make my closing comment?
Well, I was just going to say, I'm excited about this particular time of the year. It's like the anticipation of finding out what all the carriers are going to be doing, because we're ready to start planning for AEP. I would say agents should get their, sort of client list together if you're a current agent and be ready because, we like to put out communications with ANOX. I know Jacqueline does a lot of that and just be ready. I think on the future podcast, we'll be bringing a lot of that stuff up, when we find out what the carriers are doing so we can be strategic and help others with their plan to help as many beneficiaries as they can.
Yeah, no, that's good advice. And this year's going to be a wild one because we've already heard carriers tell Wall Street that their premiums are going up and benefit structures are going to change. And so, it's gonna be a lot of movement, potentially a lot of movement this year. And some carriers want more done on the front end, so they're maybe even going to add some time to the enrollment. So we'll see. Jacqueline, anything before we close it out?
Yeah, so as Jennifer noted, it's time to prepare for the ANOC season. So we are close to publishing our updated book of business catalog with our ANOC pieces or compliant approved pieces that we'll be sharing with the team once that's ready. And we help those agents send them out every year, 100. So lean on us there for some updates. More to come soon.
All right. Thank you. I would just end on the note to remind everybody that you, the broker, and we, the FMO, and the GAs and MGAs in between, we are a consumer protection. We are a consumer safety net. And in a world that's being, ravaged by AI, whether you love it or hate it, it's here, it's powerful, and it's going to play a role. And the cost pressures that the carriers are getting, it's going to force them to innovate. And where appropriate, they're going to use AI. And so, what we want to make sure we do, we are the consumer protection, and if we ever use AI, which we do internally, we enable the human with AI so that they can have a better advice and better service to the beneficiary or to the broker. And so I think that as the cost pressures happen and people automate things and AI is talking to AI, we want to be the human element that is the rational human that sorts it out with no artificial intelligence, all 100% human intelligence and common sense and industry experience and local knowledge. And that is a terrific value because for pennies on the dollar of what's spent, we can make the preventative nature of these services work. We can run through walls when they don't, and we can bridge gaps when they need to be bridged. And so that's an invaluable service that we offer as a combined team. We do it with the national infrastructure that's quilted together in an ecosystem. It's highly efficient. It would cost much, much more if each carrier had to replicate that. And we have the best interest we have agency and we have goal alignment with the client. A lot of people talk about agents, do things because of the commission and this and that and the other thing. But the truth is, it's a very efficient market. If you don't put the person on the right plan, someone with the right plan will find that person and move them. If you push them into something that they don't need and you don't give them service, they will move. That's why I created the metrics. And so people that act like, oh, I'm just going to give somebody $50 more and they're going to do this untoward thing, that might happen from time to time, but it doesn't usually happen because it's not in anybody's best interest because it's a very competitive and efficient market. And if you don't talk to your customer, someone else will. if you didn't put them on the right plan, someone else will, and they should. And that makes me proud. And that's why we're open for business. And that's why we hire the best people in the business so that we can deliver on that quality promise. And I want to thank you all for your time. And thanks for listening to another AHA podcast. See you next week.
Thanks.
Thank
Bye.
you.